O Equador é o terceiro país latino-americano em número de vítimas do novo coronavírus, atrás só do Brasil e do Peru. São mais de 31 mil casos, 1.600 mortes. Muito antes do coronavírus se tornar um problema no país, o Equador tomou medidas severas contra a doença. Por isso, muita gente não entendeu quando a cidade portuária de Guayaquil se tornou um dos epicentros do Covid-19 no país. A cidade tem um número tão grande de mortos, os moradores chegaram a deixar cadáveres pelas ruas.
Outside a hospital in Guayaquil, Ecuador, a family seals the coffin of their father with plastic wrap.
¿Con qué resultado? ¿COVID positivo? ¿O no?
Insuficiencia pulmonar. A todo el mundo le ponen
Le ponen insuficiencia.
¿Para qué? Para que digan que hay pocos muertos de COVID.
Many people in Guayaquil blame the government for failing to slow the spread of coronavirus and to deal with the thousands of bodies that have piled up in the aftermath. Guayaquil has suffered arguably the worst COVID death toll in Latin America. The thing is, Ecuador had acted earlier than its neighbors to close borders and order strict quarantine. So, what went wrong?
El Ecuador se infectó cuando vino la primera contagiada.
Tenemos más de 3 días llamando a esa verga.
From the start, the 1-2 punch of rapid contagion and the ensuing death toll caught local and national officials off guard.
Tenemos el primer caso confirmado de coronavirus en el Ecuador.
On February 27th, doctors in Guayaquil diagnosed the country's first COVID-19 patient, Bea Lamia, a 71-year-old retired teacher, otherwise known as Patient Zero.
She was living in Spain. She came through the Guayaquil airport and she drove through her hometown.
Dr. Esteban Ortiz Bravo is a medical investigator helping to advise the government on the pandemic.
And in her hometown, she visited all of her relatives. She went back to Guayaquil and found medical services in Guayaquil in a private service clinic. She got really bad. She went in the ICU unit. 5 days later, she got the diagnosis. So 2 doctors from that first clinic got also positive because nobody knew about it.
It took 13 days to diagnose Lamia with coronavirus, and in that time, she infected many other people, including much of her family, pictured here in 2019. In all, 3 family members died, including Bea herself.
She totally infected 17 people confirmed, but we know that the culture in Ecuador, before getting the diagnosis, could spread the virus more. We lost track right there.
After she arrived in Ecuador, Lamia stayed in the home of her niece, Cassandra, in the town of Babahoyo.
Ya nunca supo qué enfermedad tenía. Y hasta ahora muchas redes sociales nos apuntan como si mi tía fuera culpable de que el virus se propagara acá en el Ecuador.
Bea Lamia was certainly not the only case. There were at least 6 other flights from Madrid to Guayaquil between the time she arrived and when she was diagnosed. Other travelers later tested positive for COVID-19.
Ella nos contaba que en el avión ella le había dado fiebre y que mucha gente venía tosiendo en el avión. Una vez de que ella ya llega al aeropuerto, no existieron por ningún lado los protocolos.
And that was the first problem. We didn't track very well the entrance of people from the airport. So in the first 2 weeks, most of the patients came from the airport.
Those lost weeks led to an out-of-control epidemic. 2.5 weeks after Bea Lamia's diagnosis, the country was on lockdown. 2 weeks after that, Guayaquil was in the throes of the most aggressive outbreak in Latin America.
It is true that at the very beginning it was a disaster. We've learned it by mistake, but errors that we made.
This is Dr. Juan Carlos Ceballos. He was installed as Ecuador's health minister in late March, after the former minister resigned. He admits the government should have tested and tracked patients, but he also blames residents for not following stay-at-home orders after Bea's diagnosis.
Ecuador, as I said, was prepared. I mean, did all the measures in place and very early. Unfortunately, unfortunately, the people didn't hear us and they did not obey those restrictions.
Like a lot of cities in Latin America, a large segment of Guayaquil's population lives day to day working informal jobs. So to stay home means not eating. It was a perfect storm of factors that left Guayaquil's hospitals and morgues overwhelmed.
En la madrugada aquí llegan gente y se mueren aquí en la madrugada en la puerta. Aquí todo el que entra muere.
Now the government of Ecuador has another dilemma: just how to bury the thousands of bodies that have piled up in the weeks after Lamia's death. Ecuador's official COVID death toll is several hundred, but forensic police have been working around the clock to collect and account for thousands more dead. And construction is now underway for various large burial sites around the city. Container trucks like this one transport corpses to one new site on the outskirts of Guayaquil, in the neighborhood of Pascuales. Local residents, fearful of contamination, are outraged. Officials in charge of handling the dead have promised that each body will have a separate resting place. We attempted to film drone footage of the new burial site, but Ecuadorian soldiers ordered our team to bring the drone down and temporarily confiscated our footage. A human rights worker documented the incident.
Vecinos han denunciado el ingreso de trailers al menos 3 veces al día con containers llenos de cadáveres supuestamente a este cementerio donde había una fosa común.
Since the first coronavirus diagnosis, distrust of the government's handling this crisis appears to have spread as fast as the contagion itself.
Agora você vai ver uma história de uma família dividida em 2 continentes, mas que se une por meio de uma tela, só que em volta de algo muito, mas muito maior.
No me la cuentes. Todos nos corres, abuelita. Aquí estoy, mi reina. Aquí estoy. Orando. Sí, mi amor.
It's Thursday morning, and we're at the North Shore University Hospital, just across the border from Queens on Long Island. I'm Sherry Fink. I'm a correspondent at the New York Times, and I've been reporting on the coronavirus pandemic.
Hello.
This is a tiny little office in the intensive care unit.
I just want you to tell us a little bit about her.
Quiero que me diga un poco sobre ella.
And what's happening in this office right now is that a doctor and a social worker, Dr. Eric Gottesman, and social worker Elisa Vicari, they're connecting on a conference call with the family of a patient. Her name is Carmen Avilia Toro. She is the beloved matriarch of a family that stretches across South America and North America.
Mi mamá era una mujer totalmente independiente.
Mami.
Le encantaba caminar, hacía bastante ejercicio.
Buceando con la abuela.
Era una mujer que se cuidaba mucho en su dieta, siempre ayudando a cuidar sus nietos, sus bisnietos, y era una mujer completamente física y mentalmente activa.
Okay.
They don't have a lot of hope for her to recover from this very severe lung damage that she suffered from the coronavirus, and they want to talk with the family about what to do next.
And it's not like her lungs have collapsed, they're just very stiff, kind of like an old sponge that won't work anymore. We are trying right now a last-ditch effort to give her some high-dose steroids to see if we can get her lungs any less stiff. If they don't work, there's nothing else really that we can do to help her.
Because of the coronavirus and the risk of contagion, family members aren't being allowed in the intensive care unit. And so Elisa Vicari is going into Miss Toro's room. And then she's connecting with Miss Toro's family so that they can actually see their loved one. And they're wondering if maybe this is goodbye because they don't know how long she'll live.
Te estoy extrañando mucho acá. Que tú eres una guerrera. Que tú eres la mamá de mi mamá.
Ms. Toro's family is scattered across the US and in Colombia. With the pandemic, there's no way that they can fly to come together, and they want to be there for her.
Abuelita, así estemos lejos, aquí estamos todos por ti.
Madre hermosa, acá estamos todos, mamá, explicándole a Dios.
¿Cuánto daría por estar allá, poderte abrazar?